Hello everyone, I'm Anas Al Ubaidi, and this lecture or this session is about, or the topic for this session or lecture is about Advanced Urgent Care Scribe Review, the topic for this session, and it is part of chapter 25 of the Review of Emergency and Urgent Care Scribing within the Certified Medical Administrative Assistant program by ACMSO. Introduction. Medical scribes play a pivotal role in the fast-paced and challenging environment of urgent care facilities, where efficiency, accuracy, and seamless communication are critical to delivering high-quality patient care. An urgent care setting presents unique demands for scribes compared to a traditional clinic or hospital, with a steady stream of patients presenting diverse complaints ranging from minor injuries to acute illnesses. Urgent care scribes must excel in multitasking, real-time documentation, and ensuring that the medical team can focus on patient care without being weighed down by administrative tasks. This lecture on Advanced Urgent Care Scribe Review is specifically designed to equip aspiring and practicing scribes with the advanced skills needed to thrive in this environment. Urgent care scribes act as the right hand of physicians or of the clinicians in general, providing real time documentation during patient encounters, managing electronic health records (EHR), and facilitating efficient communication between different members of the healthcare team. Beyond these standard functions, advanced skills in urgent care scribing require an ability to document complex medical histories, ensure compliance with charting standards, and anticipate the needs of the provider during high pressure situations. For example, prior knowledge of the protocols for high volume conditions such as respiratory infections and orthopedic injuries ensures that notes are thorough and accurate even when patient encounters are brief. This level of expertise directly impacts patient safety, streamlines workflow management, and plays a vital role in reducing provider burnout in urgent care settings. One of the key challenges that urgent care scribes face is the rapid pace of the environment. Providers or clinicians must assess and treat multiple patients efficiently, leaving no room for documentation errors or delays. Scribes must stay organized, prioritize tasks, and maintain composure under pressure, all while ensuring the accuracy of detailed documentation. For instance, they may encounter situations where diagnostic orders, follow up care instructions, and prescription details need to be captured simultaneously. Errors in any of these areas could lead to delays in care or legal and compliance issues. Advanced training prepares scribes to handle these challenges with confidence and precision, emphasizing attention to detail and proactive management of their workflow. Accurate documentation in urgent care settings serves as more than just medical record keeping. It aids in effective continuity of care, supports billing and coding processes, and ensures compliance with medical legal standards. Well organized and detailed notes reduce the risk of claim denials and audits while helping providers or clinicians make informed decisions for follow-up care. Additionally, as healthcare documentation continues to evolve, scribes must stay updated on changes in technology, legal regulations, and compliance requirements. This dynamic underscores the importance of continuous learning and adaptability in the scribing profession. Advanced courses like this review are designed to provide scribes with best practices, highlight common pitfalls, and refine core competencies to meet the demands of modern urgent care practice. Key points. With the key points, we have the real-time documentation. We'll start with the real-time documentation. As accurate and efficient real-time documentation lies at the heart of a scribe's role in urgent care. The ability to record clinical encounters as they occur ensures a seamless flow of information, minimizes errors, and enhances patient care quality. Comprehensive charting. Urgent care scribes must document each patient visit with precision, capturing medical histories, symptoms, physical exams, diagnoses, treatment plans, and follow up instructions. Example: for a patient presenting with chest pain, the scribe should note the onset, duration, associated symptoms, and relevant diagnostic tests, for instance, for example, EKG or ECG or X-ray. Significance, completeness, and accuracy in documentation provide a solid foundation for continuity of care and facilitate correct coding and billing. And here is a diagram summarizing the documentation requirements, patient visit details, example case importance of accuracy. Standardized templates and protocols. Standardized templates in the EHR electronic health record allow scribes to efficiently document common urgent care complaints, such as upper respiratory infections, sprains, or lacerations. Example: utilizing check boxes and drop down menus for regular case types reduces documentation errors while maintaining a consistent level of detail across patient records. And here is a summarized diagram on enhancing EHR documentation efficiency, as we have consistent detail level, efficient documentation, common urgent care complaints, checkboxes, drop-down menus, error reduction, and then going back to consistent detail level as a closed circle. Adapting to EHR software, electronic health record software, proficiency in multiple, often complex EHR systems is an essential skill for scribes. Example: navigating quickly between charting sections during a busy day, such as pasting prescription notes while simultaneously recording patient education details. Challenge here: staying up to date with the frequent EHR upgrades and innovations requires regular training. Advanced communication skills. Effective communication is vital for functioning as a bridge between providers or clinicians, staff, and occasionally patients in urgent care settings. Advanced communication skills not only enhance workflow but also prevent misunderstandings that could compromise care. Anticipating provider needs, advanced scribes must learn to predict what information or documentation a provider will require during a patient encounter. For example, at a provider's queue for ordering imaging, the scribe should anticipate inputting the accompanying clinical justification into the EHR electronic health record. Benefit here: reduces delays and keeps examinations flowing smoothly. Professional interactions. Scribes must communicate succinctly with providers, clinicians without interrupting patient care. Example: asking clarifying questions about medical decision making during a lull in the encounter rather than while the provider is addressing the patient. And here is a note and the note is: remaining professional and unobtrusive builds unobtrusive. So remaining professional and unobtrusive builds trust and respect within the urgent care team. Interdepartmental coordination. Communication extends beyond providers to include radiology, lab technicians, and administrative staff. Example: relying urgent test results uh, or ensuring referrals are sent to specialty clinics in a timely manner. The outcome here: smooth interdepartmental collaboration benefits both patient care and operational efficiency. Workflow management. Urgent care scribes must juggle multiple tasks without compromising accuracy. Strategic workflow management enables them to maintain pace and handle high patient volumes effectively. Multitasking, as scribes must manage multiple priorities such as charting patient visits, documenting diagnostic results, and processing urgent orders simultaneously. Example, while documenting a physical exam, for one patient, the scribe may need to update lab results and enter follow up instructions for another. Prioritization during high volume. During peak hours, scribes should prioritize tasks that most directly affect immediate patient care. Example, inputting lab orders in the EHR electronic health record should take precedence over creating templates for follow up notes. Time management techniques. Developing time-saving strategies ensures scribes can handle a demanding workflow without burnout. Example, maintaining templates that can be modified quickly for recurrent patient complaints eliminates redundant typing and allows focus on more critical documentation. Handling high pressure situations. Urgent care centers deal with acute and sometimes life threatening conditions. Scribes need the composure and capability to perform efficiently under stress. We have here stress management or resilience. Remaining calm and focused is critical when documenting critical cases such as trauma or cardiac emergencies. Example, accurately recording provider actions during advanced care, cardiac life support ACLS procedures, including medications administered and time-stamped events. Proactive problem solving. Scribes must identify solutions to workflow bottlenecks independently. Example, if the EHR, electronic health record system, crashes during documentation, the scribe should be prepared with alternative methods such as handwriting detailed shorthand notes for entry later. Learning from critical incidents. Reviewing past high pressure cases helps scribes improve their response for future scenarios. Example, creating checklists or flow charts based on experience to prepare for similar high stakes emergencies. Importance of compliance and continued education. The need for accurate and compliant documentation continues to evolve alongside legal and technological standards. Scribes must adopt a lifelong learning mindset to maintain excellence in practice. Regulatory knowledge. Scribes must stay informed of regulations affecting documentation practices to avoid medical legal repercussions. Example, revising chart audits to ensure compliance with HIPAA standards and billing guidelines. Regular training updates, ongoing education in new scribing techniques, software updates, and urgent care specific methodologies ensure scribes remain adaptable and provide high value services. Example, participating in workshops covering documentation for telehealth sessions, which have become more relevant in urgent care. Quality assurance reviews, regular audits, and feedback on chart quality help scribes refine their skills. Example, provides providers or clinicians reviewing scribe notes can highlight areas for improvement, such as adding omitted details or clarifying vague entries. Summary tables next. Here we have a table on key elements of real-time documentation: aspect, description, example, benefit, challenge. Aspects, we have comprehensive charting, use of templates, real-time accuracy, integration with diagnostics, patient care details. Table on advanced communication skills, skill, description, example, benefit, challenge. Skills, we have anticipation, professional interactions, interdepartmental coordination, clear documentation requests, managing feedback. Table on workflow management techniques, um, BV, description, example, benefit, challenge. Techniques, we have multitasking, prioritization, efficiency tools, task segregation, downtime management. Table on strategies for high pressure situations, strategy, description, example, benefit, challenge. The strategies, we have stress management, quick decision making, using checklists, effective delegation, incident review. Table on compliance and continuous education, area, description, example, benefit, challenge. Areas, we have regulatory compliance, periodic training, quality assurance, staying technology enabled, and peer feedback. Then we will revise what we have covered through this lecture through some MCQs or multiple choice questions. Question 1. Which of the following best describes the purpose of real-time documentation by urgent care scribes? A. To create a summary of patient interactions after the visit concludes. B. To ensure accurate and detailed records are created during the patient encounter. C. To replace the provider's role in writing diagnostic and treatment plans. Or D. To focus on documenting only the patient's symptoms and ignore provider decision. Answer would be B, as to ensure accurate and detailed records are created during the patient encounter, as real-time documentation allows scribes to capture the complete details of the patient interaction as it unfolds. This minimizes errors and facilitates timely and accurate record keeping that providers can rely on for decision making. Question 2. What advanced communication skill is most critical for scribes in urgent care environments? A. Reporting every detail of the patient visit to the provider. B. Anticipating provider needs and relaying relevant information fluently. B. Asking the provider for clarification during every phase of the patient encounter. Or D. Independently making treatment decisions to assist the provider. The answer is B. Anticipating provider needs and relaying relevant information fluently, as anticipating provider needs helps scribes streamline workflows, reduce delays, and add value to urgent care interactions by supporting the provider adjust the right moments without interruptions. Question 3. How should the scribes prioritize their workflow in a busy urgent care setting? A. Complete every patient's chart in full before starting a diagnostic orders. B. Focus on tasks affecting immediate patient care first, such as lab or imaging orders. C. Wait for downtime to document visits in bulk across multiple patients. Or D. Perform all tasks simultaneously without prioritizing urgent versus non-urgent cases. The answer is B, as to focus on tasks affecting immediate patient care first, such as lab or imaging orders, as scribes must prioritize tasks that have a direct impact on patient care, such as diagnostic orders, as these help expedite treatment and improve outcomes. Supporting real time decisions is always the primary focus. Question 4. Which is the best strategy for scribes to manage high pressure situations effectively? A. Focus solely on one aspect of patient care to avoid mistakes. B. Utilize checklists or predefined workflows to ensure critical details are not missed. C. Avoid taking notes until the critical situation is fully resolved. Or D. Delegate all document tasks to another team member. The answer is B. As by utilize checklists or predefined workflows to ensure critical details are not missed. Using checklists or predefined workflows ensures that key actions and data points are captured accurately even in high pressure scenarios such as emergency care situations. Question 5. Why is ongoing education important for advanced urgent care scribes? A. To help scribes take on roles as medical decision makers. B. To ensure scribes stay informed about changes in documentation regulations or technology. C. To reduce the time needed for patient documentation to under 5 minutes. Or D. To allow scribes to replace administrative staff responsibilities. The answer is B, as to ensure scribes stay informed about changes in documentation regulations or technology. So be informed, be up to date within guidelines and standards, as being up to date, as continuous education keeps scribes updated on the latest legal, regulatory, and technological changes, enabling them to maintain compliance and excel in dynamic healthcare environments. And here we come to the end of this lecture. Thank you very much and goodbye.